The Miracle of Healing. Ever wonder how your body fixes itself? Written by Dr. Oz. Have you ever cut yourself and watched in amazement as your body repaired the damage? It seems like magic, but wound healing is a complex and fascinating process. It happens in stages, each one crucial for successful healing. Understanding these stages can help you appreciate your body's incredible ability to heal and learn how to best support this natural process. Calling all first responders, stopping the bleeding and forming a protective shield. The moment your skin is broken, your body leaps into action. It's an incredible, almost instantaneous response that showcases the body's remarkable ability to heal itself. The first stage is all about damage control, stopping the bleeding and protecting the wound from infection. This is crucial because any delay can lead to excessive blood loss or an increased risk of infection. Think of it like your body calling 911. Just like emergency responders rush to the scene of an accident, your body has its own rapid response team. Platelets, tiny cells in your blood, rush to the scene and clump together, forming a clot that plugs the wound and stops the bleeding. These platelets are like the first responders, arriving quickly to manage the situation. This clot also acts like a protective shield, sealing the wound from the outside world and preventing germs from getting in. It's a critical step in the healing process, as it creates a barrier against harmful bacteria and other pathogens. It's like your body's own natural bandage, providing a safe environment for healing to begin. This natural bandage is essential because it not only stops the bleeding but also sets the stage for the next phases of healing. Under a microscope you can see how these platelets change shape and become sticky, allowing them to adhere to the wound site and to each other. This stickiness is what helps form the initial clot. As the platelets gather, they release chemicals called clotting factors. These clotting factors work together in a complex cascade to strengthen the clot and ensure it stays in place. But the platelets aren't working alone. White blood cells also arrive at the scene, ready to fend off any potential invaders. They play a crucial role in preventing infection and cleaning up any debris. Meanwhile, fibrin threads weave through the clot, creating a mesh that holds everything together. This mesh is like scaffolding, providing additional support and stability to the clot. Over the next few days, the clot will harden and form a scab, which is a sign that the healing process is well underway. Beneath the scab, new tissue is being formed, and the wound is gradually closing. Eventually, the scab will fall off, revealing new, healthy skin underneath. This entire process is a testament to the body's incredible ability to repair itself and protect against harm. While your body is equipped to handle minor injuries on its own, it's always a good idea to keep a first aid kit handy. Applying a bandage can help protect the wound and keep it clean as your body works its magic. And remember, keeping your hands clean is one of the best ways to prevent infection. Simple hygiene practices can go a long way in supporting your body's natural healing processes. So the next time you get a cut or scrape, take a moment to appreciate the incredible teamwork happening within your body. It's a well-coordinated effort that ensures you heal quickly and safely. From the initial rush of platelets to the final formation of new skin, every step is vital. Your body truly is an amazing first responder, always ready to jump into action and protect you. Calling in the troops, how your body fights back against infection. Once the bleeding is under control, the next stage focuses on fighting off infection. This is where your immune system takes center stage. Special white blood cells like neutrophils and macrophages are dispatched to the wound site. These cells are like the body's soldiers, engulfing and destroying any bacteria that may have entered the wound. They also release special chemicals that help to clean up the area and prepare it for the next stage of healing. Rebuilding the damaged tissue. Building a bridge, laying the foundation for new skin. With the wound clean and protected, your body can now begin the task of rebuilding. This stage is all about laying the foundation for new skin to grow. Special cells called fibroblasts enter the wound and start producing a protein called collagen. Collagen is like the building block of your skin, providing structure and strength. It forms a network of fibers that act like a bridge, connecting the edges of the wound and providing a framework for new tissue to grow on. From the ground up, the scaffolding of new tissue. As collagen production continues, the wound starts to fill in with new tissue. This new tissue, called granulation tissue, is initially red and bumpy in appearance. Don't be alarmed by its appearance. This is a good sign that healing is progressing well. Granulation tissue is rich in blood vessels, which supply the wound with oxygen and nutrients essential for healing. It also contains special cells that continue to produce collagen, further strengthening the wound and preparing it for the final stage of healing. The final touch is remodeling and scar formation. This is the stage where the body refines and strengthens the newly formed tissue, ensuring that the wound heals properly and efficiently. Over time, the granulation tissue matures and the wound gradually closes. This granulation tissue is rich in new blood vessels, which are essential for delivering nutrients and oxygen to the healing area. The collagen fibers that were initially laid down in a haphazard way begin to reorganize, becoming more aligned and tightly packed. This reorganization is crucial because it provides the wound with the necessary strength and structure to withstand daily activities. This process, called remodeling, helps to strengthen the newly formed tissue and improve its appearance. Remodeling can take several months to years, depending on the size and depth of the wound. During this time, the body continuously breaks down and rebuilds collagen fibers to optimize the tissue's strength and flexibility. Eventually, the wound is fully closed and covered with new skin. This new skin is a protective barrier that shields the underlying tissues from infection and further injury. This new skin may be a slightly different color or texture than the surrounding skin, forming what we know as a scar. Scars can vary in appearance, ranging from flat and pale to raised and darker, depending on factors such as the wound's location, the individual's skin type, and the nature of the injury. Scars are a natural part of the healing process, a testament to your body's remarkable ability to repair itself. They serve as a reminder of the body's resilience and its capacity to overcome injury. While some people may feel self-conscious about their scars, it's important to remember that they are a sign of healing and recovery. In some cases, scars may fade over time, becoming less noticeable. There are also various treatments available, such as silicone sheets, laser therapy, and surgical revision, that can help improve the appearance of scars if desired. Ultimately, the presence of a scar is a small price to pay for the body's incredible ability to heal and regenerate. What can slow down the healing process? While your body is designed to heal itself, several factors can affect how quickly and effectively wounds heal. Age plays a role, as healing tends to slow down as we get older. Our diet also plays a crucial part. A diet lacking in essential nutrients such as protein, vitamin C, and zinc can impair wound healing. Certain medical conditions such as diabetes can also interfere with healing. Smoking is another culprit as it restricts blood flow and deprives the wound of oxygen. Even stress can hinder the healing process by suppressing the immune system. Lending a helping hand tips for optimal wound care. Proper wound care is essential for ensuring that your body heals efficiently and without complications. Whether it's a minor cut, a surgical incision, or a more serious injury, following the right steps can make a significant difference in the healing process. While wound healing is a natural process, there are things you can do to support it and prevent complications. Understanding the stages of wound healing can help you provide the best care. The process typically involves hemostasis, inflammation, proliferation, and remodeling. Each stage is crucial and requires specific care to ensure optimal healing. First and foremost, keep your wound clean. Wash it gently with soap and water and cover it with a clean bandage to protect it from dirt and bacteria. Cleaning the wound helps remove debris and reduces the risk of infection. Use mild soap and avoid harsh chemicals that can irritate the wound. After cleaning, pat the area dry with a clean towel before applying a bandage. Keep the wound moist, as a moist environment promotes faster healing. Applying an appropriate ointment or dressing can help maintain moisture. Products like petroleum jelly or specialized wound gels can be beneficial. Moist wound healing not only speeds up the process, but also reduces pain and minimizes scarring. Avoid picking at scabs, as tempting as it may be. Scabs are your body's natural bandage, and picking at them can reopen the wound and introduce infection. It's important to let the scab fall off naturally. If the scab is causing discomfort, you can soften it with a warm, damp cloth, but resist the urge to remove it forcefully. Scabs are your body's natural bandage, and picking at them can reopen the wound and introduce infection. This can lead to prolonged healing times and even scarring. Keeping the wound covered and moist can help prevent scab formation altogether, making the healing process smoother and more comfortable. If you notice any signs of infection, such as redness, swelling, pus, or increasing pain, consult a healthcare professional immediately. Early intervention can prevent more serious complications. Infections can delay healing and lead to more severe health issues if not treated promptly. Always keep an eye on the wound and seek medical advice if you have any concerns. By following these tips, you can ensure that your wound heals properly and efficiently. Remember, proper wound care is not just about treating the wound itself, but also about supporting your body's natural healing processes. Stay vigilant, keep the wound clean and moist, and don't hesitate to seek professional help when needed. Your body will thank you for it. The marvel of self-repair, appreciating your body's incredible ability to heal. Wound healing is a testament to your body's remarkable ability to repair itself. It's a complex and fascinating process that involves a coordinated effort from various cells, tissues, and chemical messengers. By understanding the stages of wound healing and the factors that can affect it, we can better appreciate this incredible process and learn how to best support our body's natural ability to heal. So the next time you get a cut or scrape, remember the amazing healing power within you and take good care of your wound.